Hello, everybody, and welcome to part one of sex and gender differences in sport-related concussions. Today, myself, Carrie Sapenko, and my colleague, Dr. Abby Bretson, are going to give a very high-level overview on sex and gender differences in sports-related concussion. So sports-related concussions affect approximately 3.8 million Americans each year. And even recent reports from the NCAA indicate that around 10,000 student athletes also experience a sports-related concussion annually. When we look at sex comparable sports, which means sports where male and female athletes both participate, we see that female athletes tend to have a higher rate of sports-related concussion. Now, sports-related concussions occur when forces are transmitted to the brain, either by a direct impact to the head or neck, or an indirect impact to other parts of the body. So what this means is that you can actually get hit in the chest, and if the impact is hard enough to cause the brain to move within your skull, then that can cause a concussion. So you don't necessarily have to be hit in the head. So sports-related concussions are caused by biomechanical forces, which can cause an injury via the brain hitting the sides of the skull, or result in axonal injury caused by stretching and shearing of neurons in the brain. This results in an alteration of mental status that may or may not involve a loss of consciousness. And typically in sports-related concussion, there isn't a loss of consciousness. We see that in approximately 10% of our athletes or patients. So the signs and symptoms of a concussion really fall into four different types of groups. This includes things like physical symptoms, so things like headache, nausea, dizziness, impaired balance and postural control, and impaired gait. We also see cognitive symptoms, so things like feeling foggy, difficulty concentrating, impaired memory, forgetfulness, and confusion. We also see emotional symptoms, so things like feeling more irritable, sadness, anxiety, nervousness, lability and mood, and personality changes, as well as sleep disturbances, so things like feeling more drowsy, sleeping more than usual, or sleeping less than usual, and sometimes even having troubles falling asleep.
And so moving into sport-related concussions and really getting an understanding of how they occur, we're going to talk about rates of sport-related concussions in different settings. So we're going to focus on high school and collegiate settings. And in order to determine rates, we have to use some math. And so in these large surveillance studies that injuries are tracked over time in many different sports, these studies count the number of sport-related concussions that happen across a time period. So we then use those numbers of counts and divide the total number of injuries by the total number of athletes. And so this gives us the overall percentage of athletes that experience a concussion. Other ways we determine rates are using, again, the total number of athletes, and then divide that by the total number of athletes that play in a game or practice, and we call that athlete exposures. So we're getting the total number of athletes per athlete exposures in a given setting. And when thinking about sport-related concussion rates, in the high school setting, research has shown that concussions occur at 4.7 concussions per 10,000 athlete exposures at a given time. And similar rates are seen in collegiate settings with its either 4.5 or 4.1 per 10,000 athlete exposures overall. So when we think about overall concussion rates between these two settings, they're very similar. However, when we start to look at sport differences, or sports, we start to see differences. And so when we think about, are there differences in the rate of concussions in male and female athletes overall, we see that males typically have higher rates of sport-related concussion. However, we have to also think about the number of athletes that are participating in sports in general when we think of these overall numbers. And so what comes to mind here is football. So football has a large number of athletes participating, big roster sizes, and they also have high concussion rates. And so football is seeing a rate of 7 to 10 per 10,000 athlete exposures. And so if we have that many athletes playing, that's going to really influence our overall rates and make it look like males have higher risk than females. However, in the next slide, when we really focus on just sports that males and females or boys and girls are playing the same, so sports like basketball, soccer, swimming and diving, or softball versus baseball, when we can directly compare those sports, we see that females have higher rates in those comparable sports. Specifically in basketball and soccer, our rates are between 1.5 to 2 times higher, where in swimming and diving and softball versus baseball, our rates for females are often 2 or even 3 times higher than our rates seen in males. So comparing comparable sports, we see that females have higher rates of concussion than males, whereas overall males tends to have higher rates of concussion. And when thinking about sex differences, we think beyond just rates. And so we also find that there are sex differences in concussion outcomes and also recovery. So not just the burden, but what's happening after that concussion. In particular, some studies show that female athletes have more post-concussion symptoms. They also have greater impairments in cognitive measures. They have lower visual functioning, and they also have longer scores in reaction time after injury compared to males. Other work, though, does find there's no differences in concussion outcomes between males and females, but it's really important to note that being a female is really a risk factor for experiencing worse symptoms after a concussion happens. So these are just some examples of male-female differences in outcomes. In symptoms in particular, females tend to report more pre-injury symptoms, but are also at risk for longer recovery outcomes and having more persistent symptoms that last greater than a month after an injury. In a sample of younger patients, females took longer to recover on 5 markers of recovery, and those included returning to school without accommodations, returning to non-contact exercise, returning to full sport participation, having longer recovery from neurocognitive function, and also on their clinical recovery of vision and vestibular function. So females are often presenting with longer recovery outcomes and worse symptoms. We also measure recovery in different ways. And so at many different levels, females demonstrate longer recovery on different outcomes. So some more examples are symptom resolution, where they have longer symptoms, but they're also presenting with longer return to play time or more time lost from their sport. We also find longer return to baseline on cognitive function and longer return to academics. However, there is some conflicting evidence that there's no male and female differences. And so that's something that's really important to consider, and more research is really needed as to finding out why these differences are present. And as mentioned previously, we also find there's differences in symptom presentations, which can then influence recovery time. So in a recent study, we found that women were reporting more of those emotional symptoms, like feeling more emotional, irritable, sadness, or nervous or anxious. And then those that were experiencing those symptoms have longer recovery outcomes. So we have to think of what these athletes are experiencing and how that influences their recovery time, which can help explain some of these male and female differences. So in summary, we found higher rates in sex comparable sports, but we also found differences in concussion outcomes and recovery between males and females. In that female athletes are experiencing a greater severity of symptoms after injury, and the data for sex differences in cognitive functioning is more mixed. However, we also find premorbid differences in symptom reporting and cognitive function need to be accounted for when evaluating these differences. And last, there's conflicting evidence existing between sex differences in some of the return outcomes, with recent work suggesting within sport differences might be needed to help explain these differences between males and females and if they exist or not. So thank you for listening to part 1, and I hope you tune in to part 2 of our talk.